I'm here with my patient Dale Thrall. He's here today for a head to toe physical. Are you okay if we videotape this?
Yes, I am.
Okay. My name's Beth. I'll be your student nurse practitioner today. How are you feeling today?
Okay.
Good. Yeah. We did his vital signs and everything was good before he got in here. His blood pressure was good. You keep a good diet to try to keep your heart rate and blood pressure under control?
Yes.
That's good. Do you have any trouble getting here today?
No.
He seems to be alert and oriented. He dressed for the weather. It's a hot one today. So, do you have any pain today?
No.
No. You drink plenty of fluids
Yes.
today? So we're going to start out with our assessment. We're going to start with the head and work our way down. We're going to inspect his head for his hair. This is an easy one for him. I'm looking for the color, texture, turgor, if he's sweating, any scars, I don't know, parasites, alopecia. I don't see anything. Everything looks good. We're going to look at your eyes. They look symmetrical. His nose, everything is symmetrical. I'm going to touch his ears. Is there any pain in your ears?
No.
And can you take off your glasses?
Sure.
You can put them back on later. I'm going to pull down the sclera. And they're clear, no drainage. His whites of his eyes look nice and white. Any pain in your jaw there?
Nope.
Nope. Can you open your mouth and shut it? Okay. You can put your glasses back on.
Thank you.
I'm just going to touch your face. I want to go through your sinuses and make sure nothing painful, any pain anywhere.
Nope.
I want to use a Q-tip here, and can you close your eyes? I'm going to test the cranial nerve, the trigeminal, and I'm going to see if he can feel this light touch to his forehead.
Yeah. Uh-huh.
Okay. Good. I did it here, so can you, I'm going to I'm going to test cranial nerve number 7, the trigeminal, the facial. Number 7 is the facial. Can you clench your teeth? Open, close your mouth, smile, frown, raise your eyebrows. What about puff out your cheeks? Good. That all looks pretty good. Let me get this light here. We're going to look inside your mouth. Open up your mouth. I'm going to look for his teeth, dentition. It looks nice and moist. Tongue, can you stick out your tongue side to side? That is testing the hypoglossal cranial nerve. So his tongue looks midline, no problems. And now we'll test the gag. Can you say ah? His tonsils are there. Stick out your tongue. Okay, tonsils are there. Uvula is midline. Everything looks good. Gag's intact. Uvula midline. We said that. And then we tested the vagus cranial nerve number 10 when I made him talk and with the tongue sticking out. Now I want to palpate his lymph nodes. this pre-auricle here, post-auricle in the back, occipital back here. Looking for palpating for masses. Tonsillar. Submandibular. And then the cervical. Submental I did. Superficial cervical, posterior cervical, deep cervical, and then the supraclavicular. They all look pretty good. Now I want to do this hearing test. I'm going to do a couple of hearing tests. I'm going to sit this on the top of your head. You tell me if you hear it in both ears, okay?
Okay.
Feel it. No,
No.
I didn't think I did it good.
No. Yeah.
Yeah. And then I'm going to do both ears, and we're going to do one for the bone conduction and then one for hearing. Okay, ready?
Yeah.
Tell me when you can't hear.
I can't.
We're going to do one more over here. I don't think I did that good.
Yeah, I hear it.
So it should be, you should hear air longer than you hear the bone conduction. That turned out, that looked pretty good. So now I want to take a look inside your ears. You've got some wax in there. Let's have a look in this ear. There. Well, that looks good. And then my pen light again. I'm going to take a look at your eyes.
Take these off?
Okay.
Okay.
Look at your eyes. We're going to do some vision tests and make sure that his eyes do the same thing. I'm just going to shine this pen light in your eye and make sure they... Good. Nice and reactive. I'm going to cover... No, I want to shine it in the left eye, see if the right eye does the same thing. Now I'm going to do the opposite. Let me see in your nose. You have any trouble breathing?
No.
Through your nose?
No.
Okay.
Good.
You're supposed to cover one eye. We did the eye chart when we was doing the vitals, so I forgot your cover. That's fine. Now I'm gonna move down to your neck. Just gonna. Can we take off your shirt too? 'Cause
Sure.
I'm gonna move down to the neck, so I'm just going to look at the skin around his neck. It all looks good. He's not sweating. He's got good color. No scars. No does have a scar here, but it looks good. I'm gonna palpate the trachea, make sure it's midline, and it is. I'm gonna step behind him, and I'm gonna ask him to swallow, and we're going to check and see his thyroid. Swallow. Good job. Okay. I felt that nice. Good. No masses. No. Any pain anywhere that I touch you? Now I'm going to. I just want to feel your carotid arteries. I'm going to do one at a time. Nice and strong pulse. I'm going to get my stethoscopes. We're going to turn it on the bell. And I'm going to listen for his carotid, listen for bruit or just breathe. And no bruit, no nothing on that one. That looks good too. No bruise. Maybe even a little bit. Now we're gonna move down. Let me do one more test on your. Can you push your head against my hand, and then backwards, and then that side, and this side? Okay, good. It's nice and strong. So now we're going to move down to his chest. We're looking for any, again, color, texture, turgor. He's not sweating. No heaves or palpations. Everything looks good. He's got hair distribution here, nice and normal. I don't see any accessory muscles used. His breathing is nice and regular. Now I'm going to listen for his breath sounds. Well, I could take a nice deep breath. I could put my hands under his breasts, rib cage, and see that he's breathing nice and symmetrical. They both seem. Now I'm going to turn this back to the diaphragm. And I'm going to take a listen to his breath sounds. I'm going to start here. And these are bronchovesicular breath sounds, these two. I'm going to do right, then left, then vesicular, and then bronchial on this side. Nice, easy breath. Big breath. You don't feel like you're going to pass out or anything?
No, I'm fine.
So we did that. Now I'm going to listen to his heart sounds. There's a couple different heart sounds. The second intercostal space on the right is the aortic valve, and I will listen to it over here. Pulmonic. And then this third intercostal space on the left is Erb's point. I'm going to listen to that. If I was thinking he had an irregular heart rate, I could listen right here for 1 minute. And then mitral tricuspid, and then mitral at the 5th intercostal space. So I'm going to listen to his lungs, his heart sounds now with the diaphragm. Tricuspid. Okay, all sounds good. Everything looks good on that. I wanted to test cranial nerve 11, the accessory muscles. So I'm going to press my hands here. Can you elevate your shoulders against my hand and then down? Okay. Now I'm going to take a look at his back, and we're going to do the same thing. Can you stand up or just go over to the side so maybe that way they can see your back so they see what I'm doing?
How's that?
Yeah. I'm inspecting his back. It looks good. Same as the front. Good color, texture, turgor, no sweating. He does have freckles. He's got hair distribution nice and normal back here also. I'm going to feel for any tactile fremitus or any air that I feel back here, and it's all good, nothing. Now I'm going to take a listen to his lung sounds here. I'm going to avoid the scapular, and I'm going to do the same. Right, left, down, left, right, and one more time with the diaphragm. Deep breath. Okay, one more. Good job. Thank you. All sounded nice and clear. No adventitious breath sounds. Now I'm going to do some percussion on his lung fields. And it should just be like a dull sound, like and I'm just tapping on my finger to make that sound. It sounds good. I don't hear anything that's hyper resonant or anything that would indicate any fluid. The spine's nice and straight. Any tenderness back here?
No.
Okay. You can turn around if you want. Sorry. All right. So and now we'll do his arms. We're working our way down. Again, the skin is good. No swelling, no edema. And I'm gonna use the same Q-tip. We're just gonna close your eyes and see if you could touch those. You feel that?
Yep. Now I'm going to feel the pulses in your arm. This is the brachial, the radial,
Good. I'm gonna do the same over here. Brachial, radial, and then I just want to feel under your armpit here for your axillary glands. No, nothing, no tenderness or anything there. I don't
No.
feel any masses or lumps. So now, can you grab my fingers and squeeze hard?
Oh,
Just squeeze your hand. All right. Now stick out your hands. Now lift up against my hand and push down. All right, good. How about any range of motion? Good.
Yeah.
No pain doing that. I'm palpating the joints to see if there's no pain with each joint. The elbow. No pain.
no.
Fingers, I'm testing capillary refill here. Nice and pink. They turn color real quick. That's good. Can you feel this vibration at your wrist when I do it?
Yeah. Yes.
Alright, we're moving on. I'm going to move down to your legs. I don't know if you could see, his legs are nice and good, no edema. They're nice and pink, no swelling, no redness, any pain in your calves or anything.
No.
No. I'm feeling his pulses here on the top of his foot. Behind his toe is the dorsalis pedis, nice and +2, 4. And this posterior tibia behind his ankle here is good. Let me see this one. Same thing. Good. And good. Now I'm going to, how about test the strength in his lower extremities? Can you lift your leg and push it towards me? How about in? Okay. And this one. And then how about do you have good range of motion in your hips? Everything is good. How about your toes? Can you,
Yep.
your ankles, I mean?
Yep.
There you go. With your knees, you could straighten them and bend them.
Yep.
No pain, no nothing. Okay. I'm going to do some tendon reflexes with my hammer. I'm going to start with the brachial. And I should see it move the brachial muscle, and this will, I know, ready? Okay. We'll do the same with the radial. And I'm watching for his, just relax. His thumb, and this will move. Okay. I'm gonna do this, just relax your arm, let it hang there. Just relax. down to his legs. It's hard to see, but I'll let you know. We're gonna do the patellar. You gotta scoot back so your legs are dangling a little bit. There you go. And then I'll do the Babinski by rubbing the thing on the bottom of his foot and see if he does that. And this one, alright. And then I'm going to do the back of the Achilles. I'm going to press up lightly on his foot and it should press down like that. And then I want to test the capillary refill, his toes. They look good. Okay. I'm going to move my stuff here. I'm going to have you lay down a little bit so we can look at your abdomen. Can you come this way so we can see it on the... Okay, let me get my stethoscopes.
What?
I'm gonna put your legs down
Oh.
and then put your head on the pillow. While I have him in this position, we're gonna test for, see if we see any JVD. Can you turn your head to the right? This isn't the perfect position. He should be up 45 degrees, but I don't see any JVD or distension indicating that he's having some fluid problems. Is that uncomfortable?
Nope.
Alright, I'm looking at his stomach. It's nice. Do you have any pain?
Nope.
Nice color. No scars. No abdominal surgery. I'm going to palpate it a little bit at first, like I was doing. Any pain?
Nope.
And now I'm going to go a little deeper so I can feel your liver and other organs to see if there's any masses. So the liver is over here on the right. No pain?
Nope.
Okay, that's pretty good. Now I'm going to listen to 4 quadrants of his abdomen for vowel sounds with my diaphragm. Good, they sound all good. I can hear his dinner. And then I'm going to go below the xiphoid process above the umbilicus and listen for his aorta. Nice, irregular. I don't hear any bruise or anything. So then 3 fingers above the umbilicus and 2 over, I'm going to listen to the right renal artery for bruise, or the same with the left. And then 2 fingers is the iliac, and 2 fingers over. Same on the left. And then the femoral is down here. Okay, all sounds good. I don't hear any bruise or now that I have you here, just going to look better at your knees. Can you lift your knees now that you're laying down and straight? Okay, and how about the other one? Straight. All right, and any pain in your back or
Nope.
anything when you do that? Okay. Just looking at you while you're laying down and palpating the joints of his ankles. No pain?
Nope.
No swelling? Toes is good? We did the ankle. Can you and push on the gas pedal? Any pain in the back of your calves while doing that?
Nope.
No. All right. I'm gonna have you sit back up. I did forget to do some vision tests. These ones are, I'm going to test your, the way visual feels.
Okay.
You just follow this
Okay.
up here. Can you see it?
Uh-huh. Uh-huh. Uh-huh.
You don't move your head, just your eyes.
Okay.
Yeah?
Yep.
That was testing cranial nerve 2. Can you stand up for me?
Sure.
I'm going to move this. Hold your hands out and close your eyes and do a finger to nose.
Okay.
Okay. And then if I drew a number or a letter here on your hand.
B.
Okay. And what about this
D.
one? Okay. And if I whisper something in your ear, can you hear it? Oh, no, you gotta
Oh.
stand.
Sorry. Yeah. Yes.
Okay. We did the refill. Now, how about your shoulders? Nice and straight. Can you? There you go. Roll them forward, backwards. Okay, good job. What about arms? In abduction and adduction. Okay, good. No
Rotate.
pain when you do that.
Nope. And I can rotate.
Okay. And then a couple more and we're done. Thank you.
Okay.
Can you bend over and let me look at your spine? Spine looks nice and straight. No scoliosis, no nothing. Okay. And then, how about, can you rotate your hips like, oh, that's good, you're doing good. And then, there's one more I want to do to see if you can put one foot in front of the other and walk in a
Okay.
straight line. All right, good.
Uh-huh.
Now, how about just on one foot?
Okay.
Okay, and then the other foot?
Okay.
Okay, that's good. Have a seat.
Okay.
Thank you for letting me do that to you.
Huh?
Everything looks good. Your lungs are clear. You can move everything. Your cranial nerves seem to be everything intact. Your vision's good.
Right.
And that's all I have for you today. Do you
Okay.
have any questions for me?
No.
All right. That's it.
All right.